Welcome to Migrant Conditions Network's On the Move podcast, a podcast dedicated to providers and health advocates who work with vulnerable populations, including migrants and immigrants.
Welcome and thank you for joining us for today's episode. Folks 65 plus can risk less and do more by getting respiratory vaccines this fall. I'm Deliana Garcia. I'm the Chief Program Officer for International and Emerging Issues at the Migrant Clinicians Network, and I get to be today's host. In my role with MCN, I have developed programs like Health Network, which is our international bridge case management and patient navigation system. We want to make sure that patients have their medical records available to them as they cross any line, state, international, whatever. And so in that role, I also get to work with folks who are looking at emerging issues like vaccine preventable diseases. And so today, I want to welcome to our podcast Renee Edwards and Dr. Laszlo Medeiros, because they're going to talk to you about the Health and Human Services Risk Less, Do More campaign and the risks of illness and the benefits of vaccination for underserved groups, including patients who are over 65 and those who are pregnant. So welcome to Renee. And Dr. Medeiros, can I call you Laz?
You sure can.
Great. Well, Renee Edwards is MCN's Director of Training and Technical Assistance, and she holds a Master's of Public Health from the University of New Mexico. She began her career in public health as a volunteer with the Peace Corps in Honduras, a theme that's going to continue with Dr. Medeiros as well, and has worked for many years at all levels, from city to international government agencies, with real attention to infectious disease prevention, control, surveillance programs, focusing a lot on community education and training for clinicians and staff. Her specialties include HIV, STI, sexual health, tuberculosis, refugee and immigrant health, maternal child health, and strategic planning. And through her work, she focuses on health equity, cultural humility, and language access. And Dr. Medeiros, Laz, is MCN's Chief Medical Officer, and he's responsible for the oversight of all of MCN's clinical activities. Laz received his MD and Masters of Public Health from Tufts University, School of Medicine. He's worked all over the world. He too was a Peace Corps volunteer, and then in the 1990s, in 1994, he worked on the Congo-Rwandan border during the Rwandan genocide. And so he's brought so many of those lessons with him. And since 96, he's worked as a board certified family physician in both inpatient and outpatient medicine, in pediatrics, adult medicine, and obstetrics. He's a frontline clinician and was at Keystone Health Center, a community health center in Pennsylvania, where he cared for farm workers and their families, serving as assistant medical director from 2001 to 2005. He became a hospitalist in 2005 in Chambersburg and Waynesboro Hospital in South Central Pennsylvania, where he continues to work part-time to this day. So I want to really focus, both of you all, and thank you so much for being here with us today, on really the questions around the importance of vaccines for individuals who are 65 years old plus, as well as those who are pregnant. So I think if you don't mind, I will go ahead and start with you, Laz, and say, tell me a little bit about the importance of, vaccines and the role that they play, especially for patients who are 65 and older.
Okay, great. Thank you so much, Del, and welcome, Renee, and it's great to be here. Yeah, so over so many years in medicine, I've seen the results of vaccinations improving people's health all over the world. And this goes back to even before I was born, and I'm getting to be in the 60 and over category, not quite 65, but where swimming pools were closed during polio in the late 1950s. So I came into the world a little bit after that, a couple of years after that. And I was really grateful that all my childhood vaccinations were accomplished in the 1960s and early 70s. Polio, MMR, et cetera. It was always an important thing that was never questioned, that we should be vaccinated against everything that would be life-threatening and life-ending, even in the first half of the 20th century.
But Laz, talk to me about older people, because you're right.
Yeah, so
Vaccines
this
for
is
children Really,
Yes.
I think that there's a lot of
Right,
support.
right. So starting off from that time to the older population, which is where I'm at now, also, what I want to say here is that as we get older, we tend to accumulate disease processes. Sometimes these are things we can't help. They're part of our genetic inheritance from our parents. Some people get diabetes, some people get hepatitis, some people get lung disease. As we get older, these accumulations make it more likely that if we're suffering from an additional insult from one of the vaccine preventable diseases, that we're going to get sicker, suffer more, and possibly die. Other issues, including as we get older, we use tobacco and alcohol, and so many of the adults that I see in my practice, have requirements for supplemental oxygen. Their lungs aren't as strong as they used to be. So for 65 and older, a combination of the accumulation of comorbidities
Mhm.
and some of the health preventable processes that we use, will result in a higher risk for diseases such as COVID, such as influenza, such as RSV, which fortunately are vaccine preventable.
So you're talking about the 65 plus group and the processes that can come over time. In that same vein, though, we frequently kind of bring in the whole issue of pregnant people as well. And what's the issue for them?
So with pregnant people, we can vaccinate the pregnant person. In addition, we get some passive immunity that passes through to the infant. So when that infant is born, they already have the advantage of having some of the antibodies that their parent has given them. And that lasts for about the first 6 months of life, most often. And then it's time for their childhood vaccinations to kick in.
Hmm.
Now, as we know, the immune system is always poised to get um, any type of infection that comes to your system. But the disadvantage is then you have to be sick and you have to recover. And pregnant people and the elderly have a harder time recovering. So we've given them the advantage of a vaccination. The vaccinations that we're talking about are very helpful to avoid the unnecessary falling sick from the illness itself and rather get the advantages of having an immune system that is poised and ready to be induced to protect the pregnant person and the adult over 65 from getting the illness itself, which often is life saving. And I can say that, having worked in the hospital for over 30 years in the United States and other places, that it's the people who don't take advantage of vaccinations that end
Yeah.
up sicker, that end up in a hospital having to be seen by a doctor like me in the hospital, often ending up in the intensive care unit on a ventilator, et cetera. And I really want to avoid that. And that's why I always encourage people to be vaccinated, especially the 65 and older and pregnant people.
Renee, we're going to turn to you because the other thing that I think comes up in all of this, and Laz, you may want to weigh in as well in a second, is, beyond 65 plus and pregnant people, we speak frequently of the importance of including immigrants and migrants, the Spanish speaking populations or non-English speaking populations. And I think some of this, both the age and condition populations, as well as then special circumstances, are the folks that you're really trying to work with in this partnership with the Health and Human Services Risk Less, Do More campaign. What brought about the partnership, and what is the goal for MCN's work in the partnership?
Sure. And, first, I just want to make a little disclaimer that, as an employee of Migrant Clinicians Network, I can't speak for the Department of Health and Human Services or for the Risk Less, Do More campaign, but I can talk about our partnership with them with the purpose of promoting this kind of vaccination for seasoned and migrant agricultural workers, for immigrant communities, and for folks that don't speak English very well. Because of Migrant Clinician Network's reach among clinicians that serve migrant and seasonal farm workers, immigrants, people with limited English proficiency, and our reach directly to those communities, they partnered with MCN to spread the word about respiratory vaccines beyond general English language advertising. So, our goal is to really try to reach clinicians that whose purpose is really working with the migrant and seasonal farm worker community and with immigrants. So we really want to reach them and make sure that this message is getting beyond the general English speaking audience that most of the promotion is going to go to.
And so we want to hear a little bit more about the campaign. So set it up for us.
Risk Less, Do More is really trying to use uplifting, colorful, family-oriented in particular messages for diverse communities to provide resources and help increase awareness and access to respiratory vaccines. So there's a whole wide variety of videos that are available. There are materials that clinicians can use with their patients, and there's stuff that's really just trying to reach these communities directly. And it's very family-oriented, really trying to help people think about the bigger picture of who they're living with, who they're interacting with, what they're doing to enjoy life.
I'm going to go back to Laz for just a second, because Laz, it seemed like during COVID, there was a lot of how is it that we get this message out to groups so that they can understand the risks and the environment in which they're living. And I think that was one of the things that you spoke to a great deal.
Yes, yeah. During the years of the pandemic, we were trying to work with community health workers and trusted leaders to get the message out, the correct message out on COVID, the vaccination possibilities, and how they could get the care that they needed from clinics that were open. And Migrant Clinicians Network really helped connect some of the people that were working in very, very high-risk jobs. High-risk jobs, not only because they're working in things like assembly lines and places that there was fast-moving action, but also because they could not use personal protective equipment as other places could use. So they're close together at work, they're close together in the commute home, and in their homes, which often were trailers. People would be together in larger groups, and it was very easy then to have viruses transmit from one person to another, even if the people themselves knew how to prevent this from happening. Sometimes they could not adhere to some of the guidelines that were recommended by the CDC. And I think our migrant population is especially vulnerable for those reasons I mentioned.
Right.
That has to do with how they lived.
Right.
Fortunately, we did get the message across, and in my area in Pennsylvania also, that most of them did get vaccinated. And that's a great tribute to an organization like MCN that we're able to get that message out and get as many people vaccinated as possible.
Yeah. I think that, we did demonstrate some considerable work and strength. And Renee, I think you're carrying it on. And I think the program that you have in place to do here with this partnership in the Risk Less, Do More campaign is in the spirit of what we've always tried to do. But please tell us a little bit more about the messages, about the design, about what you're trying to look at, anything that you'd really like to note.
I think, some of the critical things are just really thinking about how the people around you also can influence you. So if I'm thinking about my mother, if I'm thinking about my aunt, if I want to make sure that they're going to be okay for the holidays coming up and we're all together and who knows who's coming with what, right? So really trying to think about, how to help your family members get vaccines if they need them, or other people that you might be looking after, especially if they have any kind of chronic conditions. If you've got relatives who live in a nursing home or are in, for extra care, those are folks to be thinking about too. And as well as pregnant people that might be in your life and coming to your events, or just that you're going to spend time, right? The whole idea is that really, literally, they want people to have less risk so that they can do more of the things that they like. And it may be with your friends, it may be with your family, but really having things safer. And who wants to be in bed sick or potentially in a hospital when you could be having a great time with your loved ones?
And I think that that's really great to hear, because I think so much of what happened in the early days of COVID was there was a discussion of risk, and then there was a willingness of people to throw caution to the wind and go ahead and be not well or, potentially ill, and then mixing and being at parties. So tell us some of what are the resources that are available, Renee?
Sure. So there are, like I said, there's resources for clinicians. So if clinicians have things that they want to give to individuals that are 65 or older or that are pregnant, if they have something that they want to give to someone who's there with their family to help their family member get the care that they need. There's a lot of things like that. There's a lot of social media going on right now that's trying to get people all in all the circumstances to help increase this awareness and interest in getting vaccinated. But really, a lot of it is just really trying to promote the idea and motivate folks that this is a helpful thing for you. This is a thing that's going to help keep you going and having a great time.
And Les, tell me, please. I went and had all three vaccines. I had my COVID, I had a flu, and then I had RSV, and I was fine. But I had others who, struggled or were just reluctant. Talk to us about taking them one at a time or in combination. Any advice you might have for
Sure,
people?
sure. So yes, you can take them all at once. That is totally fine, medically speaking. But you can also spread them out a little bit. So the caution there is don't wait so long to spread out the last one that, oh boy, now I just caught that particular one because I waited a little too long to get vaccinated. And we do have influenza A in the hospital. We do have some of the other, COVID is still there. It hasn't gone away. We want to let everybody know that COVID hasn't gone away. RSV is there and influenza is here now. We are now, as we're talking, in the last week of October 2024, and the season is upon us, especially in the Mid-Atlantic and New England states. We're starting to feel all these viruses that are coming and are vaccine preventable. So we want to get that message out now. And I want to talk to the clinicians who listen to this to please, work with your fellow clinicians and your family members, as Renee said, to get the word out that the vaccines are here, they're available, and I recommend that you take them all at once or one at a time, but please get them all.
Get them all. And Renee, I mean, Laz is talking about educating people around the risk. I think risk discussions and understanding risks versus benefits is always such a difficult thing in any public health arena. When we talk about sort of the risk benefits, we get stuck in that place of trying to describe risk realistically, but not so that we're just stuck in negative or frightening messages. And I think that the risk less piece to do more that you have been describing is helpful in setting that kind of a tone. So, what's the goal really in this project?
Well, the goal is largely to help people feel positive about getting vaccinated, to see that there's a benefit to it, to see beyond the risk and maybe, taking it lightly or thinking this isn't going to happen to me or I had it once and it was okay. To really, again, thinking beyond yourself and with your family, with your friends, but also what do you want to be doing in the next couple months? Do you want to be in bed sick or do you want to be out doing the things that you enjoy doing? And so that's sort of the idea here is to really go from, not doing or doing things to avoid becoming sick so that you can do the things you really love.
And I think, Laz, you talked about the hospital, but now talking about the health center. When you've been working with patients, what has been the most convincing for them? What are the stories that you tell or the angle that you use?
Yeah, so I try to tell the patients who have undergone some of these illnesses themselves and had come back, said, "Do you really want your loved one to experience this?" I think not. I think if you know your grandma is, can she really sustain what you just sustained as a 40-year-old? Okay. I said, as you get to be older and you get to be 65 and older, you may not be able to withstand the illness as it stands, as it is right now. And sometimes I use them as an advocate then to spread to the rest of the family. Yes, grandma, please do get your vaccines because this is going to be really important. And one other thing, Dale, I want to touch on, and this is partly because it was discussed last month at the United Nations, is antibiotic resistance. And this is a bigger picture of how you can prevent diseases, viral illnesses that such as RSV, such as COVID, and such as influenza A, from then adding on to a bacterial pneumonitis, which requires antibiotics. So the process there of what I would suggest is get the vaccine, don't get sick, don't get pneumonia on top of the viral illness, A bacterial infection on top of a viral illness is very bad, especially if 65 and older, especially if you're pregnant. And if you can prevent the use of unnecessary antibiotics, you've saved something for your children, your grandchildren, et cetera, that we can use these antibiotics for more years. And again, antibiotic resistance is something that the United Nations, globally, WHO, I mean, we're all concerned about that as clinicians. So I would, clinician to clinician and health worker to health worker, this is another aspect of vaccinations that I would like to emphasize.
So, talking about clinicians, then, Renee, you tell me, you're talking to clinicians. What's your message to them and for the work that they need to be doing?
Sure. We are here as trusted messengers, right? People count on us to bring them the accurate information. So for clinicians, so whether, you're the doctor, you're the PA, you're the assistant that's in the office helping someone, having that information and sharing it with them really helps them have it from a source that they can trust. And so for clinicians or anyone else who wants to get some more materials from Risk Less, Do More, you can go to the website. And I think the easiest thing is just search Risk Less, Do More. HHS has a specific website that's www.risklessdomore, all one word, .hhs.gov. You can also go to the Centers for Disease Control, and theirs is a similar long www.cdc.gov/risk less do more, all one word. But again, I think if you just search the campaign itself, that's probably the easiest way to get what you need.
Well, and I think that that's wonderful that you're moving forward. And the other thing that I would want to add to it or reiterate is that MCN's been doing this for a while, right? You all had a campaign before that you were looking at. I believe it was COVID based. So I think letting everyone realize that MCN has been doing this work successfully for a long time is really critical. So if you're doing Risk Less, Do More campaign, you gave us the resources, you talked to us about why you wanted people to be engaged in it. Is there anything that's upcoming, like this podcast or another webinar or anything that you would want to let us know about?
Sure. In addition to the webinar we just did, the podcast right now, there are a few blogs that will come out. And locally, in Texas, especially, we have some stuff going on at Ventanilla de Salud offices and the Mexican consulates. There's a bunch of health fair where they're promoting the campaign and the information for people. They're promoting the vaccines. There will be some information on radio there and in newspapers in Spanish. And so we're hoping to really kind of just get the word out as we go through this respiratory illness season.
Well, thank you very much. We're at time. So I'm going to go ahead and sign this off, but I do want to thank you for coming, for speaking to us about the campaign, for speaking to us about patient care and clinician education and the work of the groups that are engaged in all of this. Any final comment, Laz?
Yes, I'd like to add that I'm very proud of Migrant Clinicians Network and our partnerships in the past with getting out information on things like COVID-19 vaccinations to our communities, again, in a multilingual format to places where it's hard to reach sometimes. And so I'm really proud of the partnerships we have formed and the partnerships we have now with Risk Less, Do More in this campaign. So I'm really excited about moving forward and using some of the platforms, some of the formulas that we've used in the past, and move forward successfully here. No, thank you very much for your questions, and I appreciate working with Renee and our whole MCN staff. We are a very motivated group of people doing wonderful things, and again, this partnership is going to be a very good one.
Renee, any last words?
So, here with, as Laz was saying, consistency is really important too, right? We've been continuing to promote vaccines as necessary and, taking care of your patients and taking care of your family, and doing it in a wide variety of ways, really just to go on and have a healthy life. And so that's a consistent thing and a consistent message. And I think that helps also build on the idea of being trustworthy and, really wanting to do well for other folks.
I agree. I think that repeated message and that continuous message of trust is really critical. So thank you all so much. for being on the podcast today. To the listeners, and you can reach me at D Garcia. I'm not sure that I can add a whole lot to your conversation, but I'm always amenable to receiving messages from folks. So please, you can connect with us through social media. MCN has a Facebook, a LinkedIn, a Twitter, Instagram. And so you should be able to find all of those links on our website, which is www.migrantclinician.org. I think you can go there and find more expert guidance and tools to improve the quality of care for vulnerable populations. Please, we ask all of you to follow our podcast On the Move with MCN. Come back and listen. And Renee, again, Laz, again, thank you all so very much.
Thank you, Del.
Happy to be here.
Visit migrantclinician.org/sign up to subscribe to MCN's news blog, get updates on new MCN podcasts and blog posts. Migrant Clinicians Network is a national nonprofit dedicated to providing practical solutions at the intersection of vulnerability, migration, and health. Donate to support our work at www.migrantclinician.org/donate. The content in this podcast is for general informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please consult official and/or federal sources for up-to-date health guidelines.